I'm an MSF doctor. I know every second counts. My name's Dr. Javed Abdelmunem. I'm a medical team leader with MSF. I first joined MSF 15 years ago. My first project was in Iraq, just after the war there, and my last project was in Gaza earlier this year. If you think of what happens to a patient when they have an injury and what they need to get back to full health, MSF is working along that entire pathway. In trauma care, there's a concept called the golden hour. Most patients who do not get the care they need in the first 60 minutes will not survive those injuries. The initial management of a severely injured patient in trauma care follows a set protocol. So when you first receive a patient, they need immediate first aid and trauma care just to make sure that they don't die from that injury if it's a severe injury. So that's at the emergency room level with a full trauma team, doing bleeding control, giving oxygen, supporting the breathing, the circulation, and fixing any broken bone just there and then with a splint or a bandage. After that comes surgical intervention. You need to have an operation, more than likely, to fix shattered bones that have been exploded or major burns that need skin grafting, for example. That's the physical side of healing. And with that, there comes physiotherapy, physical therapy, and also occupational therapy. So doing PT and OT, which are those two things, those help the patient learn how to use their body again or learn how to use their new body. After that comes mental health. Part and parcel of trauma care is healing the mind. The traumatic mental injury of suffering a war wound is big and is something that we also take care of in MSF. So it's the entire pathway of a patient's injury from the moment of arriving in hospital to being home, healed physically and mentally.